Hearing aids are one of the most effective tools for tinnitus treatment, and there's a lot of debate out there about which hearing aid is best. But what if I told you that the answer has nothing to do with the brand or even the technology most people focus on? There's one overlooked feature that makes all the difference for tinnitus relief, and hardly anyone's talking about it. In this video, I'm going to walk you through the 5 most important things you need to know before buying a hearing aid for tinnitus, and to make sure you have the right one for your tinnitus treatment. Because if you choose the wrong device or skip over these key features, you could miss out on the relief that you've been hoping for. My name is Dr. Ben Thompson, audiologist and founder of Treble Health. We've helped over 1,000 patients with hearing aid treatment for tinnitus, and I have some hearing aids right here I'm excited to show you. So let's get into today's video. Number 5 on my list today for things you have to know is understanding the link between hearing loss and tinnitus. Most people know that hearing aids help you hear more clearly, but what they don't know is that over 80% of people with tinnitus also have some level of hearing loss. And when I talk to my patients, they mostly say, I have a tinnitus problem, but I don't really notice hearing loss. So what's happening here? Well, when you lose hearing, your brain tries to compensate by turning up the internal volume, and that's often what triggers or worsens tinnitus. The good news is that a properly programmed hearing aid can reduce both tinnitus and hearing loss symptoms at the same time. This isn't just theory, this is backed by research and clinical experience. Because better hearing helps reduce the contrast between the external sound and the internal ringing that you hear. And that can make a huge difference in how my patients process tinnitus, how their brain can reduce tinnitus over time. Number 4, a key point that I want you to know is that you need to choose a hearing aid with built-in sound therapy. Now here's the part no one talks about. Modern hearing aids can be more than just turning the volume up. They can also be programmed as sound therapy medical devices that do not rely on Bluetooth. Here's an example of a high-quality hearing aid that has sound therapy inside of the hearing aids. It does not rely on Bluetooth to have sound therapy. Here's an example of some over-the-counter hearing aids that do not have built-in sound therapy. And here's some invisible hearing aids that are hidden in the ear canal that do not have built-in sound therapy. And finally, some devices that I use quite frequently that have built-in sound therapy. If you look at them, you'd say, oh, those are hearing aids. People tell me hearing aids should work for tinnitus, therefore I just need to pick the right hearing aid. But the nuances here really matter with the treatment. If your hearing aid does not include built-in tinnitus features, you're missing a critical opportunity. I'm talking about things like built-in nature sounds, tinnitus masking programs, relaxation tones like Zen therapy or white noise, and other tools specifically to help calm your nervous system and support habituation. I've found that these features are essential to get the best tinnitus treatment, and without them, you'll be stuck constantly pulling out your phone and trying to stream Bluetooth manually just to get some relief. I found that that's not ideal for my patients. That method relies on your phone, it drains the battery life of the hearing aids, you get interrupted by notifications like texts and different sounds, and it reinforces to your mind that you have tinnitus. Now compare that to sound therapy through these SmartRick devices that I have right here, which have built-in sound therapy, a robust library of sound therapy. When my team of audiologists program devices like this for our patients, we're choosing the specific sound that mixes in the best with the patient's tinnitus, and then they put it on their ears, they set it and forget it. They don't have to adjust it throughout the day. And that makes a big difference in reinforcing what's called habituation, or the brain's natural ability to reduce the tinnitus over time through consistent sound therapy, typically over a period of months, where the patient would listen to these devices on their ears undergoing a tinnitus treatment. The number 3 feature that you must know in hearing aids is to get the right kind of app control and have an option for high quality Bluetooth streaming. I found that my patients do best when their devices can be easily adjusted for things like speech clarity, different sound therapies, and the volume control. In addition to having the sound therapy in the hearing aid, I also want to give you the option to stream sounds directly from your smartphone. You see, the best apps, they give you control over white noise, pink noise, nature sounds, and custom frequency shaping. Ideally, you'd be able to listen to this all through your hearing aids. And there's even some custom specific sounds that you might have found the most relief from. For example, like the shimmer sound on our YouTube channel, we'll put that right there, you can check it out, or certain kinds of cricket sounds. It's surprising, but those provide a lot of relief for our patients, and you should be able to choose those sounds in real time if you need to. For example, if your tinnitus is really behaving badly or you need some relief because things are really hard, you might want to put on your most effective sound therapy, and sometimes those are only available on YouTube. They're not inside of the hearing aids. So ideally, you're primarily using sound therapy inboard the hearing aids, but then you'd have the option to use Bluetooth streaming to play your custom sounds. I call them variety sounds that you might have on YouTube. And just because a hearing aid has an app doesn't mean it's user-friendly. I've seen apps that are clunky or limited, and I've seen others that give you full control. That level of customization can make a big difference in your day-to-day life, so make sure that you really get your full system in order. The devices on your ears, plus the app, and the good Bluetooth connectivity. Now, a quick word from today's sponsor, Widex, a global leader in hearing aids for tinnitus. Their best hearing aids are the SmartRick and the new Allure products. SmartRick, which I have right here, is an excellent product for tinnitus, and Allure was launched in spring of 2025 and is expected to roll out its tinnitus features later this year. Widex builds products with tinnitus relief in mind. We use them quite often on our team at Treble Health when we're working with patients. It uses Zen therapy and Sound Relax, which use specific therapeutic sounds to reduce stress and support habituation in your tinnitus treatment. The Widex app allows full control over different tinnitus features and soundscapes, and it's one of the most intuitive apps we've tested. Widex also has one of the broadest bandwidths of frequency processing of any hearing aid available today, making it especially effective for patients with high-pitched tinnitus. If you'd like to get Widex hearing aids and start a risk-free trial through a local clinic in your area, use the link in the description to find a provider near you. Now back to our list with number 2, picking the right hearing aid style for tinnitus. Let's talk about something that often gets overlooked, the style and fit of the hearing aids. Most people with tinnitus have high-frequency hearing loss, which means the best option is usually a receiver in canal style. Now, any good hearing aid for tinnitus will have the option to have a rubber tip in the ear canal that has what's called an open dome. We'll put some images of that on the screen right now. That provides high frequency amplification and feels more natural. For most patients with tinnitus, they only have a high pitch hearing loss. And an open fitting with a rubber tip in the ear canal looking like this is by far the most comfortable option for a majority of our patients. This type of design, the receiver in canal style, like I'm seeing here, with a rubber tip that's open in the ear canal, that gives the best results for tinnitus treatment for patients who either have just tinnitus or tinnitus with a hearing loss. Let's compare that now to, say, this in the ear style that's completely occluding and closes the ear canal. All right, so this is going to create what's called the occlusion effect, where suddenly all the sound processed through your hearing system is going to come in through the hearing aid. And for someone who just has a high-pitched hearing loss, it's better if we use an open dome in the ear canal so we can send in the natural good hearing you have in the mid-frequency tones and the low-frequency tones, the bass and the mids there, and that mixes in with the amplified high-pitch or high-frequency sound coming through the hearing aid and the open dome. So for most people with tinnitus, we really discourage completely blocking the ear canal, whether that's with an occluding hearing aid like the one I have in my hand, or AirPods, or other kind of closed domes that fully close the ear canal. If, however, the patient has low pitch hearing loss and mid pitch hearing loss and high pitch hearing loss, essentially hearing loss across a broad range of frequencies or pitches, then it could be very appropriate to use a closed dome or an occluding hearing aid in the ear canal. So this receiver in the canal style, it's more discreet than you think. I'll go ahead and put one of them on my ear right now so you can see. These behind the ear receiver in the canal style hearing aids are very discreet and much less visible than you might think. I find that our patients get the best result with this particular style. Now let me put on another design for the receiver in the canal style. Some patients come in asking for the smallest, most invisible option, but ironically, many in-ear models are more visible from the side. The receiver in the canal style, which you just saw me put on twice, balances performance and appearance very well. And if you're in quiet environments often, you'll also want hearing aids with a low compression threshold, which does not amplify environmental sound too much, and a broad bandwidth giving you access to a wider frequency range of hearing. That allows the devices to pick up soft sounds in your environment and reduce the contrast with your tinnitus, making the tinnitus be less intrusive. Now, number one, when we're looking at best hearing aids for tinnitus, do not overlook battery life. Another practical factor here is how long the device can last you throughout the day when you're not streaming Bluetooth, and then separately, how long the device can last if you are a regular Bluetooth streamer, either with sound therapy, podcasts, or our YouTube channel, which I'd recommend that you subscribe to. So sound therapy only works if your hearing aids are powered on and working. Same thing with the amplification. If your batteries die halfway through the day, the tinnitus can come right back and you don't have your tool that you need to get the relief and to undergo the treatment. So I'd recommend looking for rechargeable models with at least 16 hours of battery life, or go with a replaceable battery if you prefer quick swaps on the go. If you're a truck driver, for example, you might need this disposable battery. But if you live a normal schedule, a normal life, the rechargeable models are only getting better and better with their battery length. And I find that almost 95% of new hearing aids provided today are rechargeable batteries that work very well. If you do Bluetooth streaming, it will drain your battery. Either way, you need a device that can keep up with your life and with your tinnitus management plan. Now, I want to give you a few of my top picks for hearing aids that are excellent for tinnitus in 2025. Resound Vivia is a great overall choice because it offers amplification and strong tinnitus sound therapy through the Resound app. Widex Smart Rick, which we just talked about earlier, is our top choice at Treble Health for the calming sound therapy and the high frequency performance for patients with hearing loss. Also, the Signia Charge and Go iX has some unique sound therapy features and is a quality device. Phonak Lyric is worn 24/7 even when sleeping and offers consistent amplification for those who want something totally invisible. Although it doesn't use sound therapy, that Lyric device can be effective for many patients' tinnitus. So if you're dealing with tinnitus and don't know where to start, my team at Treble Health is here to help. We specialize in tinnitus treatment and offer personalized telehealth consultations. Our audiologists can program your hearing aid specifically for tinnitus, provide coaching based on cognitive behavioral therapy principles, and walk you through every step of the way during your tinnitus treatment. If you'd like to learn more, please click the link in the description to book your free consultation. And if you found this video helpful, subscribe to our channel here for expert guidance, product reviews, and tinnitus management strategies. My name is Dr. Ben Thompson. I got a next video up for you right here if you want to keep watching. So thanks again, and I'll see you in the next one.